Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk. First aid. What would you do if a coworker called and said someone was injured? Have you taken first aid training so you would know what to do? The construction industry is a leader in accidents and the injury rates continue to be high, so knowing basic first aid is a must. First aid is as easy as ABC, airway, breathing, and CPR, cardiopulmonary resuscitation. In any situation, apply the GoalZero action plan. GoalZero stands for danger. Always check the danger to you, any bystanders, and then the injured or ill person. Make sure you do not put yourself in danger when going to the assistance of another person. Response. Is the person conscious? Do they respond when you talk to them, touch their hands, or squeeze their shoulder? Send for help. Call the emergency number and summon medical assistance. Don't forget to answer the questions asked by the operator. Airway. Is the person's airway clear? Is the person breathing? If the person is responding, they are conscious and their airway is clear, assess how you can help them with any injury. If the person is not responding and they are unconscious, you need to check their airway by opening their mouth and having a look inside. If their mouth is clear, tilt their head gently back, by lifting their chin, and check for breathing. If the mouth is not clear, place the person on their side, open their mouth and clear the contents, then tilt the head back and check for breathing. Breathing. Check for breathing by looking for chest movements, up and down. Listen by putting your ear near their mouth and nose. Feel for breathing by putting your hand on the lower part of their chest. If the person is unconscious but breathing, turn them onto their side, carefully ensuring that you keep their head, neck, and spine in alignment. Monitor their breathing until you hand it over to the ambulance personnel. CPR, cardiopulmonary resuscitation. If an adult is unconscious and not breathing, make sure they are flat on their back and then place the heel of one hand in the center of their chest and your other hand on top. Press down firmly and smoothly, compressing to 1/3 of their chest depth, 30 times. Give 2 breaths. To get the breath in, tilt their head back gently by lifting their chin. Pinch their nostrils closed, place your open mouth firmly over their open mouth, and blow firmly into their mouth. Keep going with the 30 compressions and 2 breaths at the speed of approximately 5 repeats in 2 minutes until you hand them over to the ambulance personnel or another trained person, or until the person you are resuscitating responds. The method for CPR for children under 8 and babies is very similar, and you can learn these skills in a CPR course. Defibrillator. For unconscious adults who are not breathing, apply an automated external defibrillator, AED, if one is available. They are available in many public places, clubs, and organizations. An AED is a machine that delivers an electrical shock to cancel any irregular heartbeat, arrhythmia, in an effort to get the normal heart beating to reestablish itself. The devices are very simple to operate. Just follow the instructions and pictures on the machine, and on the package of the pads, as well as the voice prompts. If the person responds to defibrillation, turn them onto their side and tilt their head to maintain their airway. Some AEDs may not be suitable for children.